Hello and welcome to my channel. My name is Jazzy RN. I have been a remote utilization review nurse for over 9 years, and the goal of my channel is to help nurses pivot from the bedside to remote work. Now, this job I found was with Personified Health for a UR nurse position, and this is the most thorough job posting I've ever seen in my life. So I want to go over this job posting with you to help you understand exactly what utilization review nursing is. So this very first bullet point here, it says provide professional assessment and review for the medical necessity of treatment requests and plans. So that basically means a patient comes in the hospital. Let's say, I always use this example for the inpatient admission for bowel obstruction because I had the inter-qual requirements memorized. So the patient comes in with bowel obstruction. The CT scan must state that the patient is positive for a bowel obstruction. The patient must be NPO, NG tube to suction, and IV fluids. So if all those criteria are met, that means you can't approve the authorization as an inpatient stay as approval on the nurse side. If one criteria is not met, you must send the information to the doctor, and the doctor will make a decision on whether to approve or deny the authorization. And you'll actually send a template, you'll actually enter a template. The template is the same thing as a bedside report. So just think back whenever you were, let's say if you were a nursing student and you were doing research on your patient before actually caring for your patient, this bedside report, or aka research, on the insurance side is called a template, and you'll forward that information over to the doctor, and this will all be entered into the platform you're using for utilization review. The next bullet point is provide first level review for all outpatient and ancillary pre-certification requests for medical appropriateness, inpatient hospital stay including mental health, substance abuse, skilled nursing and rehabilitation for medical necessity, and post-claim or post-service reviews. Staff are expected to cross-train and provide cross-coverage as needed. Now this job with Personified Health, it's a lot more detailed. Now, as a utilization review nurse, I'm only reviewing now inpatient admissions. Observation admissions are considered 48 hours or less. So for this position, this nurse will be reviewing authorizations for not only inpatient in the hospital, but also behavioral health. So mental health and substance abuse is also considered behavioral health, skilled nursing, and rehabilitation as well. And the post-claim and post-service reviews, I'm guessing they mean that's the same thing as the long-term acute care, skilled nursing facility, and inpatient rehabilitation. So, and also the staff are expected to cross-train. So let's say a new nurse comes on and they want you to be a preceptor for the new nurse. So you actually help train a new nurse about how to review clinicals and so on. And this cross-coverage part as needed, that's basically meaning, let's say you'll be bouncing back from inpatient to outpatient or maybe post-acute care. And the post-acute care is considered skilled nursing facility, long-term acute care, and inpatient rehabilitation. Work to the top of the RN license and ensure proper referral to medical director for denial authorizations through independent review organizations. Now this first part, work to the top of the RN license, I'm not really getting what they mean by that, but basically if you are ensuring proper referral to medical director, that means you're sending the authorization to the doctor because it doesn't meet medical necessity. Now this bullet point doesn't mention if they are using inter-qual or MCG, but if there's an authorization that you cannot approve using either inter-qual or MCG, you just send it to the doctor and the doctor makes a decision from there. And sometimes, let's say, depending on what insurance company you work for, if you are working on the weekend, and sometimes some insurance companies don't have the doctors work on the weekends, you'll send your authorizations that don't meet medical necessity to an outside independent review organization. And you'll also a different platform for that, and they'll also send information back regarding the authorization being approved or denied. But this is basically what this last part of this sentence means. deny authorizations through independent review organizations. This next bullet point, work with hospital staff to prepare patients for discharge and ensure a smooth transition to the next level of care. And this basically means when a patient is going to be discharged, if the patient is being discharged home with home health, you are assisting with finding a in-network home health service that will cover the patient's care. And the same thing with a skilled nursing facility, inpatient rehabilitation, or long-term acute care facility. This next bullet point, refer requests that fall outside of established guidelines to advanced review or senior care consultants. Now, sometimes there are some requests that are above your head. So let's say, for example, a patient is in-house and needs a transplant. That's considered to be a high dollar amount review or authorization. So you would need to get a doctor involved and just forward it over to a doctor regarding the authorization being approved and how long that inpatient stay would be approved for. That's actually just being forwarded to a doctor. This next bullet point, process appeals for non-certification of services, complete non-certification letters when appropriate. Now this job for Personify Health is very, very much in depth with lots of different parts of utilization review. Now the appeals department is a totally different department than utilization review. So basically when the authorization gets to the first nurse to review for medical necessity, and let's say that this authorization does not meet medical necessity using interqual or MCG, is sent to the doctor. That's step 2. The doctor decides that he or she will not approve the authorization for whatever reason. Then the next step, which is step 3, is a peer-to-peer review. The peer-to-peer review means that the doctor with the hospital and the doctor with the insurance company have a conversation about the authorization and the patient being in-house, and the hospital doctor is going to try to convince the insurance doctor to approve the authorization. If the insurance doctor is not willing to approve it, the last step, which is step 4, is appeals. Now, I don't have any long-term appeals experience. I do have only 2 weeks experience with appeals where I cross-trained because I needed help in the department. And basically, you're reviewing clinicals the same exact way as the utilization review nurse is reviewing clinicals. The only difference is on the appeals department, on their side, they have a lot more clinicals to review because the patient has been in-house maybe 2-3 days or even more. The next bullet point, review plan document for benefit determinations, attempt to redirect providers and patients to PPO providers. Now this is regarding Personify Health. With the insurance companies I've worked for, we have never tried to redirect providers and patients to particular other providers. So this must be just something that is basically how Personify Health does their authorizations. This next bullet point, identify and refer potential cases to case management, wellness, chronic disease, and nurturing together programs. Now, I've never heard of nurturing together programs. That must be something that's a part of Personify Health. Now, of course, we, as utilization review nurses, do refer cases to case management. So, for example, if a patient is in-house and he or she was found to have, let's say, are victims of abuse, so let's say elder abuse, then we would refer to case management on the insurance side, and it also happens on the hospital side as well. Now, regarding wellness and chronic disease, this must be something that's only within Personify Health's in their plan. Complete documentation for all reviews in appropriate documentation software. So basically, this documentation is called a template, and it's very similar to a bedside report. And a template must be the same for each review you do. They have parts you must fill out. So let's say the patient's age, the gender, any comorbidities. Also, you want to include, let's say, maybe any past surgeries as well as abnormal vitals, abnormal laboratory values, abnormal imaging, any, let's say, consults included, medications, so on and so forth. This documentation will just be entered into whatever platform you are using for that insurance company or that hospital. This next bullet point is utilize guidelines in appropriate hierarchy. Guidelines can include MCG guidelines, internal medical policies, group-specific policies, and NCCN. Now, Personify looks like they use MCG guidelines, which is pretty easy to use. I did create a video about that, but the MCG guidelines is the same thing. It's very similar to Interqual, and basically you're using the guidelines to determine whether to approve, and if you cannot approve with those guidelines, which is just like MCG is being used by Personify, then you send to a doctor for medical necessity. And the appropriate hierarchy, that basically means, let's say the patient comes in for inpatient stay, you review the authorization on the inpatient stay, or I'm sorry, the acute level of care hierarchy. If the patient is admitted under intermediate level of care, that's how you review the authorization in MCG, intermediate level of care, and so on and so forth regarding the critical level of care. So some insurance companies, they decide, let's say the patient comes in under critical level of care and he or she does not meet that critical level of care in, let's say, MCG, then you can actually downgrade to intermediate level of care and review that way. But let's say, for example, the patient is admitted acute level of care, you can't upgrade it because he or she doesn't meet acute level of care and try reviewing it under intermediate level of care or critical. If they use the hierarchy on how to review the authorization. The next bullet point is ability to meet productivity, quality, and turnaround times daily. Now, productivity could be how many authorizations you've reviewed per hour. Quality could also be, let's say, make sure that whenever you are reviewing authorizations, you're using valid acronyms. So let's say COPD is quite common. Let's say the hospital or insurance company you work for has a list of approved acronyms, and if that acronym is not on the approval list and you use it in your template, then that's not a part of your quality productivity of your review. And then turnaround times, that basically means, let's say for some insurance companies, let's take for Meditech, for example, the turnaround time could be 3 days. If you are waiting past that 3 days to actually review the authorization, then you have, that authorization has now gone out of time or out of turnaround time, out of TAC. And you don't want to make sure, you don't do that. You always review within the turnaround times. This bullet point, ability to pass external audits to include URAC and NCQA. That's something internal through Personify Health. The auditing will be mostly done by the auditors within the company, and they'll give you all the steps that's needed to pass the audits, making sure you're using the right templates, and so on and so forth. Maintain HIPAA, this is spelled incorrectly, compliance per company's policy and procedures. That just means whenever you are working in a room that has a door that locks. They don't want you to have family members coming in, seeing what you're doing because you're looking at patient's care, patient information. Sometimes authorizations or clinicals has the patient's social security number on the clinicals and the patient's name, date of birth, address, verifiable information. So to make sure you don't have that just out and about in a common area in your home where your people who live there with you can see the information. And you know, maintain confidentiality and minimum required rules, which is the same thing as HIPAA. You want to complete all required yearly training per company's expected time limit. So each company you work for will have multiple modules you must complete every year. Sometimes they'll just post it on they'll send you an email saying this module is due, and you go to the internal, let's say, Personify University website, and you complete the module. Just make sure those modules you're completing them before the due date. You don't want to wait to complete those modules. complete and pass all annual testing, including IRRA at 90% or higher. Now, this is something that both MCG and Interqual has, and IRRA is basically it's how you are reviewing using MCG or Interqual, and it's for both adult and pediatric. Now, I can let you know that if you are working on a Medicare team, then all your reviews are with adults. So whenever you are, when this IRRA testing does come around, you'll be reviewing testing with both adult and pediatrics, just to make sure you just have a separate computer or your own personal laptop at your side, and maybe you can use Chat GPT or some kind of AI, or just Google search the questions, because a lot of the questions, especially regarding pediatrics, if you don't work with pediatrics normally on a day-to-day basis, those questions are hard to answer. But it is an open book quiz, and your job will give you time to complete this quiz during your work hours. They want you to have a current RN license in the United States or U.S. territory, which is nice because a lot of companies, for some reason, they don't include U.S. territory. They just say United States, or they may just say only compact state. So Personify Health is inclusive. We're including the whole United States plus United States territories. And they want you to have at least a associate's degree or diploma required. That is nice as well, because they're not requiring you to have a bachelor's degree in nursing. And only 1 year clinical experience is required. Even better, just 1 year bedside experience is needed, and required knowledge, skills, and abilities. And here are some more required knowledge, skills, and abilities, so on and so forth. The ability to sit for 6 to 8 hours, constant use of computer keyboard and mouse, repetitive use of both hands. The jobs I've worked with, none of them have ever requested to know how many words you type per minute. Once you start working as a remote nurse, your words you type per minute will increase. It just gets better and better every day. Frequent twisting of neck, occasional bending of neck and at waist. And here's your work environment. You're stationary for 50% of the time, so on and so forth. So this is the very best job I've ever seen that really gives you a detailed list of what you'll be doing for the job, and this is for utilization review for Personify Health.